I'm super excited to share with you today an interview with Marleen Jansen, who is not only a member of the team at the Yoga Therapy Institute, but who she works as a yoga therapist as part of a team in a medical center for the treatment of addictions. I'm looking forward to this talk. I hope you enjoy it. So welcome. My name is Montserrat Mukherjee, and I am the program director at the Yoga Therapy Institute. And I have here with me Marleen Jansen, who is also a certified yoga therapist with the IAYT. And she is a professional, you are a professional yoga therapist who works as a yoga therapist. And Marleen, you're based in the Netherlands, and welcome, welcome, welcome. I'm very happy to have you here. You're a member of the faculty of our school as well. But we're going to share today just a little story about what's going on with your work, how you are, let's just say you got a really interesting job as a yoga therapist, working as a yoga therapist. And tell us a little bit about it. But before you do, it's super interesting because you're going to working in the area of addiction. Is that right? Yes, working with people with issues with addiction. And but before we go and talk about it, let me ask you first of all, Marleen, a little bit about you and about your qualifications so that we know, because we're going to talk about the kind of work that you're doing. And in a way, what qualifies you, which is quite interesting in a way, because right? What is your history? What is your background as a yoga teacher and yoga therapist?
Yeah, thank you. So thanks for having me today interview. Yeah, so my name is Marleen, and when I graduated in 2017 at Yoga Campus in London as a yoga therapist, and I started working as a yoga therapist from that moment on in my private. I had a practice, private space at home, one-on-one working with clients, and gradually it's developed from private lessons, yoga, to yoga therapy, private sessions. So more and more I got individuals with health issues, all kind of health issues, and so I could apply what I learned, my skills and experience working as a yoga therapist. So I had my own private clients. At the same time, you started the school, the Yoga Therapy Institute. By that time, we were already acquainted and we knew each other from Amsterdam. So, well, from that moment, I think it was 2017, right? Yeah. You invited me to take some of the classes, some lectures, or sharing case studies. That's how it started. So I became involved with school. So maybe you know me from the faculty teaching, training and teaching at the Yoga Therapy Institute. And over time, I moved houses, Corona came and disappeared, and we continued. And then I also did a cooperation with my sister, who works as a counselor and a psychotherapist, and she had clients who needed to move, and it seems that she read the same kind of studies as we do, so that in order to address the mind, you need to address the body and the breath too. I got clients from her, working together with her, cooperation, and from end of last year, from another person that I knew, a clinical psychologist. She is working at a private clinic for individuals recovering from substance abuse, from addiction.
Right.
And especially alcohol and drugs. Drugs as in drugs, cocaine, especially cannabis, and narcotics, sleeping pills, Valium, that kind of things.
So, Marleen, you go fast. Before we go on to that, I wanted to ask you, yes, of course, you were teaching at the school, you had your own private clients. So tell us, how did it happen that you are now working? What is your position? Right? What is your position? What are you working as?
A yoga therapist.
As a yoga therapist, and it is as a yoga therapist, so it's not disguised as anything else. And what type of place are you working in? Was it a doctor's office, a medical center? What kind of center is it?
It is a center, so it's a clinic in a beautiful atmosphere, very calming, and we work there together with the whole team, with addiction counselors, with psychologists, with systemic therapists, with psychiatrists, with a medical doctor who take blood tests for and who prescribes medication for the detoxification process. So we work in a team at a location, and the clients they come once a week, and then they have 2 or 3 appointments. They see there they have a session, a talk with their psychiatrist, and then after that they have a session with me. For example, there's a mindfulness therapist, so not a mindfulness coach, but really with a bachelor in mindfulness. And also a massage therapist.
A massage
so really body, mind, an integrative body, mind, holistic approach, because the program director, CEO, he knows, he reads the same the same studies that
the same studies that are coming out. Yes, absolutely, that everybody recognizes now. That connection between the body and the mind.
Body and the mind. It's a sports program, so a fitness training program. So there, it is really holistic and integrated.
Wonderful.
And what I like, it is very inspiring to work as a team, and that you are part of that. So bringing your own profession, your own specialty, your own niche at the table, and you really do it together, and that makes the difference.
Yeah. So, and how did they find you? How come they, right? I mean, did you find them, or did you find
No. So this was very funny story, actually. So it's my neighbor, so literally my neighbors. The clinical psychologist, and so they had making their prognosis for the new year, and we need a yoga, but we need to offer yoga as well to our clients. And one of them they knew from the Bikram yoga studio in Amsterdam, a teacher there, but she wasn't interested. But she referred, well, if you look for a good yoga teacher, or you would need a yoga therapist. And then she referred to your website, to the website of our school, the Yoga Therapy Institute. So she looked online and she saw the faculty, the member, the team, and said, well, this is my neighbor. So the same instantly she called me and she said, well, we need to talk, because this is our plans, and we need a yoga therapist. I wasn't aware that something existed like a yoga therapist, so please do come by and come. And then yeah, at the same day it was, so I literally could start the next day.
Oh my God, unbelievable. Yes, it's so fascinating that you say that they thought, okay, we need to integrate yoga into the work of this clinic, which is specifically only for addictions. Is that right? Or are there other mental health issues?
No,
No,
only addiction.
only
Yeah.
for addictions. So they thought, okay, we need to include yoga again, because we know, right, that there are sufficient studies now supporting the use of yoga. And what I like about this is that it's not yoga by itself. It's got to be yoga with psychotherapy, with maybe nutrition, a physical fitness, with a psychologist, right? It's got to be that combination, a medical doctor. It cannot just be yoga by itself.
No, no.
And that is something that is very important. Anybody listening, watching, who is struggling with addictions, yes, yoga can be a tool of support, but not by itself.
No.
And of course, preferably, as that teacher said, it should be yoga therapy. So what part of your training and part of your experience do you think has helped you to be able to work with individuals with addiction?
Patience is yeah, patience is one to qualification, and yeah, really making contact, being a listener, without judgment, without prejudice, but really, yeah, the human connection, the human connection.
Yes. And what is the difference between the training as a yoga teacher with a yoga therapist that helps you with that?
Yeah.
What is the difference? Like, because you could say, oh, well, if you're a very nice yoga teacher, then hey, you could do this job, right? But what is the difference in your yoga therapy training that you think that has made the difference for you to be able to support people with addictions in this environment?
Yeah, so it's not so much about the asanas. It's not asana based. You have to be aware of contraindications, because yeah, this kind of huge transformational process, it comes with yeah, with things coming to the surface. So the trauma informed aspect, working trauma informed, is very essential. Being aware of contraindications. A lot of the clients that I work with, they have high blood pressure. They have disordered sleep. They are on medication temporary to relieve cravings, for example. They deal with depression, with yeah, so with mental health issues, so layered, so under the surface. So so the difference is from between a regular, normal yoga teacher and a yoga therapist. This comes with you need to have had that extra training, so that you know what to do and what not to do. And
Yes.
that's really something that you explore together. Every person is different, and you need to adapt. And that's of course what we learn in the yoga therapy, to adapt the yoga practices, the breath practices, to the individual. Every
Yes.
person needs a different approach.
Yeah, you cannot just arrive there with your yoga set and your yoga sequence,
No,
right? And say, okay, we're going to do this vinyasa flow because, hey, yoga is good for you. You
no.
can't. You have to really adapt it to the person. And of course, those individuals, they will also have other physical issues, because we think, okay, it's only a person with addiction. Well, it could be a person with addiction. And as you said, very rightly so, high blood pressure, sleep
Diabetes,
problems, diabetes, exactly, digestion problems, all kinds of issues,
digestive problems, exactly. Yeah, musculoskeletal problems,
musculoskeletal. So
lower back pain, start stiffness, arthritis. So it's all kind of yeah.
Yeah. Yes, of course. So and that's why you're trained to be able to work safely. Yes, because you are aware of those contraindications and adapting the practice to the person. So let me ask you something as well. How does it work? So you get there, you say, "Good morning. Who is my next client?"
Yeah.
Or do you get a dossier? Do you get some information about the patient, or you don't? Or do you still do your intake? How does it work?
Yeah, so it works a bit different than the private clients that I see, that I work with. So there is a medical dossier
Yeah.
file in a system, Medicore, so with all the appointments and also all the files, the personal files of every client. Every practitioner, after they have seen the client for the day, types a report, a little report, and so do I. So see, before I meet my client for today, I read their up-to-date file. If I see a client for the first time, then there's a lot of reading if they've been there for a while, because the procedure is 13 weeks. But a lot of clients, they need more time, so they take another 13 weeks program. So the longer the client is there, the more is there in their file, so that I'm well prepared for the day. And then, yeah, then it's the same as how are you today? So I don't do intakes. Yeah, I do when I see a client for the first time. I need to know how they eat, how they sleep, and of course we find out how they breathe, to be able to explore practices that are safe and beneficial and therapeutic. So there is a file, and after the session, so I also work with goals. So we need to have, for every client there is a therapeutic plan, a therapeutic plan. And for yoga therapy, I create my own per client goals. Like, for example, calming the nervous system is one, more generalized, but they need to calm down. And yeah, emotions and discomfort come to the surface once they are sober and abstinent of their use of substances. So some clients, there's other mental health issues going on, like autism related ASS behavior, or
HD, yeah.
Yeah, HD. And yeah, then the goals can be a bit different. Like, for example, explore to improve on their interoceptive capacity, for
Yes.
example.
Yes. Yes.
Or
It doesn't have to be a goal of, okay, the goal as a yoga therapist is that this person stops using cocaine. That's not the goal.
That's not the goal. No.
No, exactly. Yes.
The general goal is to support them in their recovery process. To improve on their sleep. I haven't met a client who hasn't interrupted sleep or sleep disorder.
Really, in the clinic, yes.
Yeah.
Yes.
Yeah.
That's one common factor that you find.
Yeah, that's one common factor. Absolutely. Yes. Yeah. So this morning I recorded a yoga nidra for one of my clients.
Well, what can I say? I mean,
Oh,
Marleen, we do call you at the school the Marleen effect. So it's very well known, it's famous at the school. So I'm sure that your clients will be benefiting from it.
Yeah.
And then you record it, you give it to them.
Yeah.
Yeah.
In the same way. But yeah, the recorded ones are in English for the school. So now I have I have to record the Dutch version.
It's harder when you teach. You're used to teaching in one language. It's hard to teach in another language. So yeah, how fascinating and how amazing. How many clients do you have a week, and how many days a week do you work?
Yeah, so I work 3 days per week, and I see 3 clients back to back.
Back
And
to back.
yeah,
And they want you for longer hours there, I hear. Yes,
yeah.
they want some more.
Yeah.
Yeah. So you are introducing another yoga therapist to the school.
Yes.
Yeah.
Yeah.
Incredible. So do you find that so it sounds like when you're working with do you also meet with the team sometimes? So I know that you have your file, that you go into your computer and you look, but do you also have meetings?
Yes, we every other week, so bi-monthly, we have a team meeting, practitioners meeting to discuss our clients, especially the ones who are who had a relapse, for example, or that that needs some special attention, or that we need to really to do some sparring and intervention about what is the best approach for them. But yeah, we have those conversations. Yes.
Oh, wonderful. And so the yoga therapist is there in
Yes,
that
it's
group of
involved.
professionals.
Yeah. And for
Wonderful.
example, I've seen him now for 3 times. A very shy, well, not shy, but very closed client, holds everything in, history of complex trauma. In the first 13 weeks, he relapsed 3 times. But his resilience. Well, I see that in every client, but especially with him, he said, "Yeah, I know it's a long journey, but I will come there in the end." But yeah, it's so sweet. But he is very tricky to work with, complex to work with. So I haven't found that crack where to approach him, where to find him. So I had a chat with the team. So because the whole of the team experiences the same. So he is very kind and shy, but very closed. It's like really like a wall. And now that so with patience, here's where the patience kicks in. With patience, with that building that therapeutic relationship, with trust, with respect, with safety, working trauma informed, and then little step by step, with very simple practices, he now starts to open up just a little bit. So, but and a lot of these very little steps will lead him walking with them. So walking with them together to, it's a long journey, but in the end, getting there.
To learn that, and a very important we could be talking for hours, but we're gonna, I know that you are pressed of time as well, but it's interesting because you said with very simple practices. Now, of course, I'm a yoga therapist and I understand what you mean, but could you share what kind of practices you will be doing, which ones you would not be doing? What does it look like in terms of a practice with someone like that, for example?
Yeah, well, so to do so very accessible practices. You need to know that he doesn't bring special clothes, not an outfit for. So he's there in his skinny jeans. So
in the skinny jeans, yeah. Absolutely, that's what it is.
And I have to ask him, is it okay for you to take off your shoes? Because otherwise he's on the mat in his skinny jeans with his sneakers. But on socks, do you want to take off your socks? No. Okay, so I give them the choice. So, but tight jeans. So it has, of course, an impact on the breathing. But then accessible practices, standing, like swinging the arms, tapping, moving, keeping things light, a bit of chatting in between. So to really to make the client comfortable, and with ease, effortless. I can do this, and then depending on the intake chat that we have for 15 minutes, I choose a theme, what would be beneficial, or I ask him or her, so what is it that you like to work on today? And if they maybe if they shared something about that, for example, with it's a long way, but I know that eventually I will come there. So that is resilience and power. Then I work with that. So we do power warrior kind of variation, but simple.
Simple. Okay. Do you pay any attention to alignment?
No.
No, I don't think no alignment. And how do you feel about? There's a lot of talk about meditation for addiction. How do you feel about getting one of these clients to sit down on the floor, cross-legged, and do a meditation for, let's say, 15, 20 minutes? How do you feel about that?
I don't know. That is not on the menu. No. Sitting on the ground, cross-legged position is something I don't use that.
Why not? Why not? Why not?
Not only because of the skinny jeans.
Well, definitely not with this one with the skinny jeans, but in general.
It's that too long sitting is it brings the mind to places of discomfort, and better to do a practice for calming the mind, lying down or legs over the chair. That's what most people like very much, because for some reason lower back pain or the lower back discomfort is very common.
It doesn't surprise me. It doesn't surprise me. Yes. Yes. So lying down with the legs on the chair, for example. Yeah, they find that
not too long. Not too long for.
Not too long, huh? Not too long. I had a client with PTSD, very severe PTSD, and lying down for too long was absolutely no way. So yeah, and for him also sitting on the floor also was not an option for a long time. We would do everything sitting on a chair. Somehow sitting on the ground is funny how for yogis it feels like, oh, ground, go down on the ground. For some people, it can be a position of discomfort and submission. And let's not forget that probably it's from a place of discomfort that they've ended up in addictive behaviors. So, right. So making them be quiet and meditate and not move in a position, right? That would not.
Yeah, so I encourage them actually to move. So if in final relaxation or in a supported shavasana, so I say, so if you feel the need to move or to adjust you don't have to lay still here. So please do so to just invite them and to not tell them what to do. No.
Yes, no, instruct them. Like, okay, here's like the instruction.
No.
How wonderful. And very quickly, how long does a session take?
3/4 of an hour.
Okay. Yes, that's perfect. Absolutely perfect. Yes.
Sometimes even a bit shorter, depending on
yes. Yes. Have you ever felt unsafe?
No.
You said that there are mental health issues, depression medication, etc., so on. And I imagine you work at the center. Yeah, you work at.
I work at the center. Yeah.
And you've never felt unsafe.
No.
And
I use my practices safely. I had that was one of my first clients, and he was just sober for 6 days from cocaine and alcohol,
Yeah.
really severe, for 6 days. So he had ADHD.
Yeah.
So he was very, very tired, fatigued. His mind, racing mind, all kind of thoughts, and he was restless and irritable and all over the place, all over the place. And actually, I went outside with him for a walk. It was his own
Oh,
his
wonderful.
suggestion. So we went for a walk for 15 minutes and then came in. And then, so not sitting, how are you? But yeah, I asked the questions, but then already moving. And so, how are you today? And so, what is it? So, talking, and then slowly, gradually going to the ground. And because he was so tired, I asked him, do you like a blanket? Oh, yes, give me the blanket. Do you like an eye pillow? And we can place the eye pillow like this. So giving options for the eye pillow, and he liked it. And he fell asleep, like not fell asleep, but he was like out within,
Yes.
yeah, within
Oh,
a minute.
yeah. Yeah.
So I stopped the rotation of consciousness, but I kept on talking to give him something, yeah, as an anchor to hold on to, and then but then it's, yeah, it is kind of out of your hands. So the person, where is his mind going?
Mm.
You don't know. And then after 2 minutes, so he was out, and then boop, all of a sudden he came up, and then there he was again. So, and then the irritability was back. So that was something like, okay, was it a good choice to
Right. Yes, absolutely. It makes you wonder. It makes you wonder, and it
makes
makes
you
you
wonder. Yeah.
realize how that wonderful lying down meditation, yoga nidra, that everybody says, oh, da, 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 in these circumstances where the mind is so agitated, and we really learn it in our training with Sus, who's also a psychologist. Sus Retra, we talk, hey, don't assume that yoga nidra will be right the solution. And as a matter of fact, with somebody with such an agitated mind, it can cause problems. And just very quickly to clarify for those of you that don't know, a rotation of consciousness is basically naming different parts of the body in the meditation, right? Feel the right shoulder, feel the left shoulder, feel the right arm, the right hand. So really all the time bringing attention to the body, nothing out there, right? No visualizations up in the sky. But yeah, so very interesting how the rules of yoga, when you work, I always say it, when you work with real people in real situations, is a completely different story, especially when in this kind of suffering. Yes. So okay, so before we close, of course, yes. What are you learning? Because of course you definitely have wonderful training. You've been teaching at the school now for so many years. And as you know, Marleen, when you teach, you learn, right? So
Yeah.
you become a master when you teach as well. And you've worked as a private yoga therapist and also in collaboration with your sister, who's a psychotherapist. But what are you learning at the moment? What is it that you're adding to your knowledge? And what is it? Would there be anything that you recommend to the students that are now doing the learning, or somebody who's thinking of becoming a yoga therapist, or studying to become a yoga therapist, or somebody who's graduated? What would be your advice, and what
Yeah.
is it that you're learning right now?
Yeah, so what I learned, let's start with that, is actually an acknowledgement and a confirmation of uh, that less is more. And I already learned that along the way in working with clients one-to-one. but really less is more, and that the most what we consider simple practices, accessible practice, they have a profound impact, and especially good as it is. So like the tapping, the shoulder rolls, a bit of moving, so throwing, what you
One of my favorites.
yeah, yeah, the 3 magical breaths, or a very, or just one magical breath. Yeah,
Absolutely, it
one
doesn't have to be the
magical breath.
3.
Yeah, but and to explore, and that's so. Yeah, that's what I learned. That every person, yeah, needs the same, but in served in a slightly different way. Yeah.
Yeah. Yes, it's interesting. As human beings, when you think about it, we all need the same. We need human connection, we need rest, we need nourishment, right? And yeah, and movement. And that's what we need. But of course, you cannot offer it and serve it in the same way. And some people are not ready to rest. Some people are not ready to move. Some people, and you have to do it very, very slowly, and adapt it to the person. So yes, and for those who are considering to become yoga therapists or take on yoga therapy, or those who are doing the training and they go, oh my God, but this is such a long training. It needs to be, right?
Yeah, it needs.
It's hard work. You need to learn.
Yeah. Yeah, there is no shortcut to no. But it's a bit what that my client said. Well, it's a long journey, but I will getting there.
Yes, this is the same for
It's the
somebody who's
same.
training as a yoga therapist.
Yeah.
Yes,
So
yes. It's not
yeah, but
something you say, yeah.
it's with all the it's such a transformative process, that from the process from a yoga teacher to yoga therapy. So yeah, but it's worth it, and it's such an amazing yeah, job to yeah, if you love people, uh, and uh, and you love to breathe and to move, and you can, yeah, you can, it's all there in one job. It's, yeah, it's really special.
It's
And
very special, yes. And there's more and more people doing work as you are, Marleen. I want to thank you so much for coming for this interview, because I feel that is I hear it more and more, that people, hey, I'm working in here, I'm working there, you're in the Netherlands. I know that in the Netherlands, they're being real pioneers of this. At a local level, I call them local heroes. There's more and more of these integrative practices, centers or clinical centers coming up, sprouting in the Netherlands, which I think is wonderful, and in the United Kingdom as well, and in the US, and slowly, this is, I know somebody else who's been doing scoliosis yoga therapy also with a medical doctor, and kind of these collaborations. So yeah, and thank you so much. And of course, you work within your scope of practice. Those people who think, oh, right, as a yoga therapist, I can be a psychologist or a psychotherapist working, that's not the case. You work within your scope of practice.
Yeah, and that's a bit of a pitfall that and that I experienced with my private clients. So they didn't see. So they came with me with complex issues, and didn't see a psychologist or a counselor, and yeah, were in a way expecting me to fix their complex issues.
Yes.
So and that's what I find really yeah, comfortable, and I feel very safe and held that I work in a team. So I can really stick to yeah, to yoga therapy. So in that conversation, the how are you today, that we have at the beginning of each session, to know what to, but I can now really go to work.
Your work, yes, and you're not a psychologist to them, you're not a psychotherapist to them, because that requires many years of separate studies as well to be able to do that. So that you stay within your scope, and that is really important. Yes. So yeah, well, thank you so much, Marleen. And well, we'll get to hear more about you and about your work in future talks, and good luck with everything. You're doing an amazing job. I can see it in your face that you're so happy. I can see that you're so happy with this work that you're doing. This is an example and an inspiration for everybody, and those who are studying to become yoga therapists, and those who have also graduated. Thank you so much. Yes.
You're welcome.
Thank you. Yeah.
Pleasure.
Yeah. Thank you. And I'll see you soon. We will see you soon. Yes.
Okay. Thank you. Bye-bye.